July 13th, 2015 Human Services Committee meeting to order. First we are looking for an approval of the agenda as printed.
So moved.
Support.
We have a motion and support. All in favor, say aye. Aye. Opposed, the same. We'll move forth with that agenda. Next, we have public comment. Is there anyone that would like to address the board? Seeing no public comment, we'll move forward with the meeting minutes of June 8th. I'm looking for a motion to accept the minutes.
So moved.
We have a motion and support. Are there any corrections, additions, deletions to those minutes? Seeing none, all in favor say aye.
Aye.
Opposed, the same. Motion passed. Next, we have the medical examiner annual report. Welcome, Dr. Mano.
Good afternoon, Commissioners. I was ready to say good morning because I was working last night, so it's still morning to me. Before you have our medical examiner's report. It's a 10-year report, to show the data. The important thing that we've done is reported it according to the total number of deaths in the county and then the manner of deaths. And then under the manner of the deaths, what were the causes. But then we also broke it down as to age breakdown per, every decade of life so that we aggregate and can tell you, who and what age group committed, or died in that particular manner. And then we also have the gender comparison as to how the deaths occurred per gender. But for today, up to now, for the year 2015, we've had a total of 171 cases that we have investigated. 83 of those to date we've autopsied. So when we do a death investigation or get a report of a death reported to us, they're not all autopsied. Autopsy is just one of the tests that we do to help determine the cause and the manner of death. And to date, we've had 31 accidental deaths. We've had 4 homicides. There are 6 pending that are still under investigation or the determination of the cause and manner of death. 9 suicides, and undeterminable deaths are 21. Under the undeterminable deaths primarily fall causes such as drugs and alcohol, and under manner of death we really can't tell whether or not they were, homicide, accidental, or intentional in suicide. So, with the investigation they get classified as an undeterminable death. And as you look through the 10-year annual report, you'll see that that number is slowly but steadily increasing, every year. Our budget for 2014, at the end of it, our revenue was 100.21% that we had collected and that we had predicted, and our expenses were 97.81% of what we had submitted to the board. And our net was 97.32. To date, our revenue is 52.81%, and our expenses are at 55.21% of our budget that we submitted. Any questions? Other than that, there are no, it's business as usual, status quo, no, particular issues that we're dealing with at this time.
Commissioners, what questions might you have? Right. Seeing none, thank you for that report.
Okay, thank you.
Next on the agenda, we have Lifeway's monthly report.
Good morning again, Commissioners. I'm here for this month's report, and I do have a handout, so if I could ask for that to be accepted.
We have a motion to receive and accept. All in favor, say aye.
Okay, in my report, I had mentioned when I had sent this in regards to the mental health first aid training that we are collaborating with Saginaw Community Mental Health in regards to providing law enforcement training for mental health first aid for Jackson and Hillsdale County. This is something that we've been working really hard to try to bring to our communities, especially around law enforcement first responders. So if you know anybody or want to encourage, this is a handout that kind of describes when that's going to happen. It's going to be in September, and we really are hopeful that we'll have a great turnout. So did want to pass that along. And that wasn't in the packet that I had sent at that time. I didn't have the flyer. The other thing that was in your packet was an attachment that outlined for our strategic plan over the course of the last year, accomplishments of the agency related to our strategic planning efforts. So I hope that you had a chance to look at that. It was quite detailed, but it does provide an overview related to many of the things that LifeWays is working really hard on accomplishing over this past year. So please take a few minutes, and if you have any questions, feel free to reach out to me, and I'd be happy to answer any questions that you might have about anything that you read in that report. The other thing that was included in the report this month that I wanted to give an update on was related to the home help services that are out there. There is some changes that's occurring, so those of you who might have some contact with people receiving home help, just to be aware of the fact that this was a change as a result of an audit finding related to that service. Many of the people that we serve also have home help services, so that's why it's important to kind of know that this is happening out there. And what it particularly relates to are those people that are providing home help for people independently. They're not doing it through a home help agency. So there's some requirements now related to making sure that there's more checks and balances related to delivery of the services. So they have a log that they have to go into and enter the information. If they don't follow through with that, their payments will be delayed. So in the event that you get a call from a constituent saying, there's problems with home help, kind of know that there are some changes that are occurring out there related to that, and encourage them to kind of follow through with the requirements that they've put into play for that program now. The other thing that I wanted to give an update on was related to the governor did pass the budget, and one of the things that we were hoping was actually going to be in the budget, but it was actually vetoed, was a section of the budget that talked about if related to community mental health, and when there was revenue funding surplus at the end of the year, whether it was general fund dollars or the Medicaid dollars, that those could be lapsed back to this CMH or to the prepaid inpatient health plan, and they did veto that. So just wanted you to be aware of that language and the implication for the CMH system. We would have appreciated that, especially in light of our current challenges related to general fund dollars. The other thing that's happening on a federal level is that there's some legislation out there called Safe Justice Act, and what this is in relation to is about things related specifically for serving the criminal justice population. So this is an important bill out there that we'll be keeping a watch on, because it does things like expand the courts related to being able to provide detox services for individuals in substance use. It also provides more opportunity and funding for things like we have here locally, the mental health court. So that would be a positive thing for a lot of individuals that are receiving mental health services through a mental health court type of arrangement. They also have drug courts, and we do have one in Hillsdale County. So those are important legislative things that are out there. Another bill that's out there is related to heroin and opiate addiction, and the fact that we continue to see, and we're even seeing that locally, related to the number of individuals that are addicted, starting off with opiates and then moving to heroin. One of the things that LifeWays will be presenting, we were going to do it in July, but I had a conflict, so it's going to be at the August Behavioral Health Summit, where we have a bunch of individuals throughout our community that have an impact on behavioral health attend the summit on a quarterly basis. And one of the presentations is around heroin and opiate addiction. It's going to be a half-hour presentation. It's a 4-group series, so if anybody's at all interested in learning more about that and what you can do as a community, I'd encourage you to attend that Behavioral Health Summit. It will be in August. And that is it for my report this month. So if there's any questions.
Comments or questions for Mary Beth? Seeing none, thank you for that update.
All right, thank you.
Next on the agenda, we have Community Action Agency. Toby?
Good afternoon. I have submitted a written report regarding our NSP program. I wanted to let you know that we were audited by HUD. They came and spent 3 days going through our files and visiting the houses that we rehabilitated, both those that were occupied and those that were empty, and we had a successful audit. There were no findings. I have to provide a plan. We had to provide a plan for tracking our activities to encourage participation of women and minority-owned businesses. In our contracting, we do it. We just weren't tracking it, showing where it was done. And so I submitted that, and that finding was cleared. So we have no findings in our audit. We are moving forward with NSP. We have currently one house on the market with a closing date this month, one house under construction with Habitat that will also close most likely this month, and one under construction on Broad Street. The remaining 2 properties will also be redeveloped with Habitat as the developer in order for us to meet our low-income requirement. And I'm guessing within probably the next 6 months, HUD will be asking us to close out our NSP program. Community Action Agency also acts as the third-party administrator for the county's Community Development Block Grant funding, which is homeowner rehab, and we are racing the clock to finalize that grant. Its end date is the beginning of August, and we are finishing up our construction. As the rehab market has picked up, we are having more difficulty finding contractors who are interested in participating with our agency. We have a little bit more paperwork than just going and doing rehab. So if it's available, we're kind of last on the list for people to participate with us. We do anticipate that we will be fully expended by the end of the grant program. One of the changes that is coming up, though, I wanted to make sure that you're aware, with Community Development Block Grant, Jackson County has typically gotten $300,000 a year. That's been our allocation. The allocation program is ending. So in order for us at this point to receive any additional Community Development Block Grant funds, we will have to apply in a competitive process. The county will have to apply in a competitive process. For the upcoming year, MISTA has budgeted their Community Development Block Grant funds with 65% of those funds going towards rental rehab, 27% for homeowner rehab, 4% for emergency repairs, 2% for demolition, and 2% for their admin. So this is a big change in the program that we'll be seeing, and we'll be discussing with, I'm guessing, the administrator's office about how, if we're going to continue to participate. At this time, I believe that's my report.
Comments or questions for Toby? Commissioner Rice?
Hi, Toby. You mentioned just now that the $300,000 for community block grants will be competitive now for Jackson County?
For all of Michigan.
So for all of Michigan?
Through MISTA, yes.
Through MISTA. So would that include the city of Jackson as well?
No, the city has a direct allocation from HUD. These are for the communities that do not. So they get their money from MISTA. HUD gives money directly to MISTA, and all the communities that are not participating jurisdictions, which is what the city of Jackson is, Detroit, Flint, they get their money directly from HUD. They're not in the competitive grant.
Okay. Next question. I think last time you mentioned something to the effect that you know, right now the idea is to rehab, owner occupied, but you mentioned something to the fact that potentially there was something on the horizon involving something to do with rehab and then maybe rental properties. Is that still outstanding?
That's what's happening with the Community Development Block Grant. So they're taking 67% of their allocation in this competitive process and setting it towards rental rehab. So that is what would be available.
Okay. And the last question, and I don't know if you had an opportunity to look at this yet, but the house that you're rehabbing right now on Broad Street 303, and then you have the one in the middle there that sort of just, in essence, ruins that whole little area right there.
The one that's about 6 inches from the property that we're rehabbing.
Yes, and it's,
Yeah.
yes, it's available for somebody, from my perspective, to demolish, but do you have any further information on that?
I contacted the holding company that was selling it, and it has been sold. I don't know who purchased it. According to the county website for the assessor, it says it's an LLC out of Michigan. But I don't know if that was the original holding company or if that's the new person who purchased it.
Okay, thank you for that.
Yep.
Commissioner Shotwell?
You have a note on here talking about a home that is currently undergoing dangerous materials assessment. Was there something else that was there before it was a residential home, or just not properly maintained?
No, prior to demolition, we have to abate any asbestos that may be in the house, and so that's the assessment that we do.
Seeing no other comments or questions? Thank you, Toby, for
Thank
that
you.
presentation. Medical care facility, the financial report. Seeing no one in the audience, we have this information that is presented to us. Veterans Affairs, biannual report. Mr. Wellahan?
Good afternoon, everyone. Excuse my hoarseness. Well, last year we partnered with the county fair, and it worked out really well with a program that they introduced to me through AT&T, where we got a sponsorship for gate receipts for the fair, for veterans that came to the fair. On the Thursday of the fair people actually reduced the price of the cost for a veteran to get in, so when AT&T gave us the grant, that it wasn't as much money that they needed to recover or replace as what a regular admission would be, so we're doing that again this year, thanks to another grant from AT&T. In fact, they gave us $2,500 last year, and it was a little more than what we anticipated we would need, so it looks like this year they're going to give us that same amount. So hopefully we'll use all of it and tell them next year we need $3,000 or something. So it's been a real nice event, because for years and years the veterans of Jackson have been hollering that they need Veterans Day at the fair.
Do we know that that'll be the Thursday as well, or is that not
It's also going to
Thursday?
be Thursday, yes.
Thank you.
I think that's the 13th of August. And so we're working on some signage with the fair people, so for the veterans to know where we're located. We were over by the stage on the south end of the Herman Gumper building last year, and we had some signage up there. We had a vehicle there too, but on the midway it was kind of hard for people to figure out where we were at. So we're working on trying to make that a little easier.
So it's free for veterans to get in that day?
Any veteran,
and it's
yep,
a combination of the county fair, taking up a portion of that, and then the funding through AT&T?
Actually, the grant from AT&T is going to cover the whole amount.
The entire amount?
Yeah,
Okay.
but to make it look like AT&T is not spending as much, they've reduced the admission that day to $3. So AT&T is only recovering that $3. So the other $2 does come from the Fair Board, I guess, if you look at it that way.
Thank you.
We'll have another mobile unit from the VA Dearborn. Actually, this will be out of the Flint Vet Center. We'll have a counselor there from the Dearborn Vet Center. We'll have enrollment people from the VA hospital. We're hoping to get someone out of the regional office in Detroit, perhaps a service officer or a VSR, someone that can come out, help explain benefits to programs. Of course, I'll be there and I can do that as well. We're going to have a couple other folks, Kate Hardwick, who is our homeless coordinator for Jackson County. She's a VA employee based out of the hospital technically, but she's assigned to Jackson. County and a half a day in Hillsdale County. She's a caseworker for veterans that's at the Hope House down in Jonesville, and she works primarily with near homeless or homeless veterans. And she's been a real asset for us, because the last time I talked with her about it, I asked her how many veterans that does she believe in Jackson County are truly homeless. And she says, well, we've worked real hard on getting that done, and there's been some other agencies that she's been working with. Community Action actually is one of them, and TTI, I'm sorry. She says right now, I believe there's less than five homeless veterans in Jackson County, which is huge, because a few years ago there was a whole bunch of them. They did an assault last year in July, and I don't know if they have plans for another one this year, to search for homeless veterans in certain areas, and 3 organizations teamed together and went in one vehicle, searched all the hot spots, supposed hot spots that they know of, and they didn't even find one that day. So that was pretty encouraging. Now, there are some homeless veterans out there. There's what they call couch homeless. A veteran that comes home doesn't have a home of his own, lives with mom and dad, you know, or brother or sister, or gets kicked around to friends. But truly homeless, the ones that are out there are the ones that don't want to be found, for whatever reason. In the report, I told you that our GDX, or Geographic Distribution report from VA, came out for 2013. It was a little late. It was about a month late this year, so we weren't able to gather all these numbers until recently. But if you look at all of this, there's been some pretty astronomical numbers spent in Jackson County by the VA. Overall expenditures for compensation and pension, insurance and indemnities, education, health care, unique patients, which is a hospital person that's had a hospital stay. The VA actually spent $66,898,000 on veterans and qualified family members here in Jackson County in 2014. It's a pretty significant number. Again, a lot of it's for programs. When you look at the actual breakdown on it, there was $35,113,000 that was actually paid to veterans in direct payments into their bank accounts, either by check or direct deposit, for compensation or pension. It also includes monies that were paid to surviving spouses or dependent children that would qualify for some of those programs. We had a little bit of an increase last year in the number of veterans in Jackson County. We actually increased 227 veterans over 2013. It's the first year we've had an increase in veterans in this county, according to the GDX, since I've taken over in 2003. So it's pretty encouraging, and a lot of people ask me, well, it must be all the new guys coming home. I don't know if it's that as much as the people that live in Jackson County that are active with the National Guard and Reserves are still counted in military. They're not counted as non-military at that point, as long as they're active with the reserve program. So I think that as those people decide to come out of those programs, that kind of raises our population just a little bit. Of course, we have 3 National Guard units and an Army Reserve unit here in Jackson, but not all of those members live in Jackson as well. I mean, they're all over the place. I know there's people actually that come from New York and Ohio and to the reserve unit, and some of the people that live here in Jackson might go to Manistee for their Guard meetings. So it's not just because they live here, this isn't the organization they belong to. But I do say, too, that a lot of the younger veterans, as they're coming out of active service, are coming back home, and I think that does have a little bit to do with the count. We're not losing our veterans from the World War II era as fast as we were a few years ago. We were actually at a rate of about 1,000 a day World War II veterans countrywide that were passing away. The VA's reduced that number now to about 514 a day. Still a significant number. They figure by 2020 there won't be any World War II veterans left. So, back to the report. Sorry, I digress a little. This $35,113,000 is $5,214,000 more than what we received for pension and compensation payments in 2013. So that's a pretty significant increase in direct payments. You look puzzled. Okay. The VA paid $3,590,000 for education and vocational rehabilitation, and paid $701,000 for insurance and indemnities. Insurance and indemnities is life insurance, basically, for a veteran that kept his SGLI, which turned to a serviceman's group life insurance. When they got out of the service, they had the option of turning it into veterans group life insurance. Or certain cases, a 100% disabled veteran, if he's under 65 and if he applies for it within 2 years of getting his rating, he gets $10,000 at no cost through the VA. And then it can add to that, above that, and pay the additional premiums on that above that. So it could have been a combination of either one of those, either a death of an older veteran that still kept his insurance from years ago, or the death of a veteran that had the $10,000 policy. There's 3 doctors and a nurse practitioner now at the clinic, and if anybody's been down by Page Avenue lately, they're putting a pretty good addition onto that building. I was told it's somewhere around 10,000 square feet. They're adding on a hearing clinic out there now, so we don't have to send everybody to Ann Arbor for that. And they're adding on more spaces for mental health issues. So they have a psychiatrist that's out there every day now, a nurse practitioner in the psychiatry department, and a whole team of social workers, but they're adding on more people because it's becoming a bigger issue. The Vietnam veterans are now at that point that most of them are older than me, and they're retired now, and now that they're not contemplating with the pressures of work and family and business and everything else going on, they're kicking back to retired, and all these things are starting to come back on them. So the VA has realized there's a bigger need now for more mental health folks available to talk to these folks, so that's part of what they're doing out there. But because the clinic out here on Page Avenue is seeing nearly 3,000 veterans now, I know Dr. Raringa, who's the head doctor out there, she and I were talking about it one day, and they said that they want 1,100 patients per doctor out there. So she's up to a little over 1,000. Dr. Mathai is up to just about 500 now. She's fairly new out there, and Dr. Sheikh is just behind her. So there's a lot more room out there for patients for the docs to come in there. We do between 150 and 180 applications every year in our office, new enrollments into the health care, and I know they have people on staff out there the 4th Friday of the month that does enrollments too. But with all of that, they spent $27,493,000 on health care for the veterans that live here in Jackson County. Now that clinic sees veterans in 3, sometimes 4 different counties, but they're counting just the Jackson County veterans when they do that. And then there was $2,973,000 that was spent on what the VA considers a unique patient, and that's someone that actually spends 2 days or more as an inpatient in the hospital. So the last thing I'd like to speak about is earlier this year, I took some classes, not really classes, but some required courses through the VA, some online things that they offer, that so I could get into a new security level of encryption with the VA, and now because of all of that and successfully passing the classes and some other training I had to do in a federal background check and some other things that took place, I am now able to access files directly in the VA system. I have a remote access on our computers at the office, so that if a client of ours is I can only work with the American Legion veterans or the Marine Corps League veterans, because those are the only two organizations I'm accredited by. But if an American Legion client comes up and asks me what's going on with my claim, I can actually go into his VA file now and see where the claim is standing and help him out a little bit, so we get a little faster result, so sometimes a little more information for him. So, anything anybody like to ask me? Sir?
Yeah, when you go to these hotspots looking for homeless veterans, do you find homeless non-vets in those areas, and do you have any way to deal with them?
I've not been to any of them with that team, and Toby's left already, so I don't know if I don't know that answer directly, probably, because they're well-known hotspots for homeless people. One of them, and the largest one that we've had, the highest population, is underneath the bridge on I-94, just west of Cooper. Back years and years ago, when we were all kids, some of us, that was the old hobo village, if you remember hearing the stories. Our dads would tell us about the hobos that rode the trains back and forth from Jackson to Lansing, and that's where they hung out. And it's still pretty much the same out there, I understand. It's all set up like a regular campground. But we found 4 veterans out there and brought 3 of them out and put them into housing. I shouldn't say we, Kate has. Yeah, I couldn't give you an exact answer to that question, but I believe they did.
Commissioner Rice?
Dave, I have a question. On obviously you're aware of this information much more than I am, or even the rest of us, but no matter where you read, whether you go online, whether you read a paper, whatever it may be, you hear in regards to veterans, from a health standpoint, that the biggest issue, the biggest struggle, the biggest problem is from a mental health standpoint, whether it be PTSD, whether it be anxieties, depression. Suicide rate, we know, is horribly high, and so on and so forth. I also know, being on 2 other boards, Lifeways and Region 2 and Aging, both those boards have made comments about certainly being willing to help with the veteran population. And I just wondered where that's at, where it might go, what kind of service do they actually get from a mental health standpoint, especially with the PSD and as well as the suicides, obviously.
If we look at the root of that, and if you read every article that talked about a veteran committed suicide, why did he commit suicide? They didn't blame it on the PTSD. They said because he had PTSD and he couldn't get the appointment is why he committed the suicide, jumped off the roof or whatever, okay? I believe that we're really, really lucky here in Michigan. The Ann Arbor VA health system went through an IG inspection last year through the VA system. It only had 3 gigs against it. It scored 97 out of 100 points, and all three of those gigs were fixed before the inspector left. We have the Battle Creek facility that specializes in mental health. What they can't do in Ann Arbor, they send them to Battle Creek. They actually have several really good in-house services or programs over there. And if you can't get it done in Battle Creek, then you go to Chicago. I mean, and that's the place in the United States to go to for VA mental health. I have not seen a lot of those problems. The bigger question that I have nowadays is about this new VA card that came out where they called it Veterans Choice, and there's a lot of confusion with that. Arizona, California, New York, the bigger populations, maybe we see some more of those other types of things that you're asking about, Mr. Rice, but even Detroit, with the population of veterans we have down there, over 100,000, I think it's 168,000, something like that. We don't have those issues there because we're really unique, I think, in Michigan, because we do have such a strong program here for the mental health, but in general, all the health care that the veterans need. So I don't know if I even gave you a good answer to what you were looking for, but I just...
No, excuse me. No, you answered certainly to an extent. I guess my question was that there's the opportunity for those type of services right here in Jackson, because obviously, people can't get from Jackson to Battle Creek or wherever just every day, or maybe even, it just depends. I mean, I guess what I'm trying to say, there's a possibility for a more immediate help with that right here, not taking away what you're already doing, but I'm just saying that there is that availability, I believe, here.
You're right. We have a psychiatrist on staff at the clinic every day. We have a nurse practitioner from the psychiatry department. There's a whole staff of other folks there. But they're not afraid to make that referral from the VA to Lifeways or Segway or some other program where they might find that this veteran could get more help or more immediate type of help. And I certainly do that all the time. I'm like, don't go to the VA. Take you 2 months to get in there. Let's go over here and see what they can do for you now.
I think another piece there to add to the conversation, though, is the interest in the willingness of that veteran to receive those services, because I had the opportunity just this last week to attend a roundtable discussion put on by Michigan Radio called Issues and Ales, and it was all on veterans returning to our community and that process of readjusting to a society, and it was an excellent conversation and discussion, focusing on the challenges that they face and the uniqueness of returning from that military background to the unstructured society. And I appreciated having our director from Lifeways there, Mary Beth, there as well, because it was a valuable conversation, and the information that was presented showed a completely different side. We want to help. We want to make sure services are provided. But that's only one piece of it. Again, it's going to come from the individual as
Well,
well.
that's exactly right. You have, the veteran himself or herself has to be the one to take that step and say, I need to do this, or I want to do this.
Correct, and it's going to be in their own
I can push
time
them in any
frame.
direction they want to. I'd take them to the
Right.
VA and drop them off. And if they don't want to stay, they're going to find a way to get out of there and not do the program or anywhere else.
Right. I also would like to share with you, Mr. Rutherford, at that event, there was a public comment, and one individual stood, and he commended our Jackson County Veterans Affairs. You were commended for the service you provide, because a lot of the people were not only from the Jackson community, but outside the area. Some of the roundtable presenters were from the Ann Arbor area. And as they shared their experiences, we had our own vets standing and saying, listen, this is what we do in our community, and we're doing it right. We're making it available, but that's only one piece of it. So I'd like to share that with you.
Thank you. Appreciate that.
What other comments or questions might you have? Seeing none, thank you for that report.
Thanks very much for your time, folks.
Next on the agenda, we have Department on Aging monthly report.
Good afternoon. The first segment of the Department on Aging report is to let you know that we've had a change with the CHORE program, and that is a grant-funded service. And we had a gentleman who was a casual employee who did our CHORE repair work, primarily installing grab bars and stair railings, making sure those safety items were installed correctly. And he retired, so what we're going to try, instead of hiring someone, we're going to have professional services install the grab bars and stair rails. So we'll have a list of licensed contractors who are willing to do this type of work. We have 2 at this point. So we're going to try this route because it can be difficult to hire someone who has the skills to do this. So we're going to go with professional services and see how that works out. And then our annual report, Danielle Paquette, our Deputy Director, she pulled all together the data for that. So I've asked her to come and do some highlights of the 2014 annual report.
Thank you. I'll just kind of go through a couple things. When you're pulling the annual report, you're always trying to picture differences that you see from year to year, and I kind of just noted a few things just for you guys today. When we looked at like community education, and we've been put a focus on trying to educate the community about dementia, and we did some outreach, went through a senior center. We also went to the library on 2 different situations and presented this topic for the community to come and hear, and also with 2 retiree groups. One for the state of Michigan and one for Clark Equipment. And really what the presentation was able to do was to get people to look at dementia and think more about the person, different ways to communicate with them, to try to understand why behaviors may occur, to not blame that person so much, but to really understand what's happening with the brain and the changes that are occurring. It was a time for us to highlight the programs that we do, talk about our support groups, and the respite programs and services that we have available to help caregivers in the community, and just to be that voice of support for families caring for a loved one with dementia. In the area of support services, this is an area that we just continue to see growth in, is with our Medicaid Medicare Assistance Program. With that, we saw like a 7% increase, and a lot of that happens during a period called open enrollment, and some people here may be familiar with that, but it's a time where people can compare their Medicare D plans to see the average cost that it's going to be for that for the year for that, what changes the plans have made. Every year the plans can make changes as far as their fees, what medications they're going to cover, differences in their tiers. So it's a big time. It usually starts about mid-October and goes till about mid-December. Our staff start learning about the plans in September to try to be able to get that information available for the community, so we see a large amount of people during that small time. And the reason that we're able to see so many individuals is we're using volunteers, and we really have some very skilled volunteers because it's a lot of knowledge that you have to take in to be able to compare like 40 different plans and to plug into a system through Medicare to figure out the best plan for individuals. So overall, we save the community a lot of money by helping them choose the plans that's going to best fit their needs. Often at the end of the year where people don't have the opportunity to look at a different plan because the enrollment period has ended, sometimes they don't know that they should re-look at those plans every year, so it's a lot of education that we do with the community. We were able to work with our IT department and to use the computer lab that's available upstairs. It really made much more of a comfortable environment for the individuals coming in for the appointments, and also a little bit more confidential instead of having so many people in one room with the volunteers, with the staff. So I anticipate that we'll make that a situation we'll do again this year. With our in-home services, we always see growth in the different programs, but the Meals on Wheels, we did see an increase. And when you say 4%, it doesn't sound like a lot, but when you really look at that number, it's about 10,000 meals. So we have a lot of community partners that help to refer to us through the hospitals, the home health care agencies, the nursing homes, just individuals that will call looking to the Department on Aging for supports. And with our social workers, it's looking to say, you know, can these services benefit individuals, you know, meeting those eligibility criteria to help them stay at home for a length of time. You know, I kind of wrote one little comment in there, you know, I think you all can see that. I want you to know how much I appreciate those meals. I really I really feel like I'm doing better because of them. Please let everyone know. We always get comments on the donation letters that we send out and receive back for people that appreciate the supports that they receive. Often at times, seniors will call and leave messages, or their family members. There's times where the home-delivered meal driver will notice a change in an individual, and they'll come back and they'll report it to the staff. And so we'll call their emergency contact to let them know that what the driver's been reporting to us. And we'll often get calls from somebody that says, you know, thank you for letting us know. You know, we didn't know there was something happening medical-wise, and they were able to get them in for treatment. So again, the little things that our drivers do on a daily basis really help our older adults to stay safely in their homes. With geriatric mental health, we did see an increase in the amount of hours that we do for support counseling. With that program, what we find is there's not a lot of individuals that do homebound counseling, and that's really an area that we feel like we can kind of fit that need in the community when you have individuals that are homebound, may not have the transportation resources or family members to help them get into and actually talk to a counselor. So they're dealing a lot with grief and loss, changes with health situation, family relationship issues, that loss of independence. And so with the counselors, they're able to help those people improve their quality of life through the counseling service. With the senior activities, we did see an increase in the amount of people coming in for chair exercise programs. We saw a 16% increase with that. Not just chair, I also want to include like our yoga, our tai chi, our Fit After 50 classes. So we do a lot of exercise promotion and education, and so again, seeing that increase in that as we're trying to reach for older adults to maintain their independence, and part of that is keeping active, not just mentally but physically. And so again, those exercise programs, it's great to see growth in those. with our Tuesday jam session, the reason I highlighted that is it's an opportunity for individuals to be able to come together, to have that socialization aspect, just being able to talk with other people. We've really seen a growth in that. We went from 340 people up to 439 people participating in that throughout the year. So that, again, that's a great increase, which again gets people more involved with others in their community. We also saw an increase in our arts and crafts area. That could include things like woodworking, painting, making cards and things like that. So again, getting seniors to come together so that they don't feel so isolated, expanding their support network by meeting new people is a great opportunity that we can provide. And that's all I have.
Thank you. Marcy, is there anything else? Yes. Okay.
That's all for the Department on Aging report. We do have another agenda item for the...
Okay, thank you. Let's go to the any of the information that's been presented to us thus far. Are there any comments or questions? So Marcy, in the report, just for clarification, under in-home services, it claims 1,145 clients received 239,063 meals in 2014. So you've got the number of clients and hours for both home care assistance and respite there as well. Again, back to the Meals on Wheels. Donations are accepted. If so, a portion of that could be covered by donations. The remainder of that comes from county budget and or the millage.
There's, excuse me, the revenue for that budget for Meals on Wheels includes client donations, grant is a large part of it, senior millage, and then some general fund dollars, yes.
So a combination of all four. Thank you. And you, your drivers go to a home one time a day, but deliver 2 meals, is that correct? Could potentially deliver 2 meals?
Yes, a hot meal for lunch and a cold meal for supper, and then frozen meals for the weekend if people need that.
All right, thank you. Thank you for that update.
Danielle, help me out. Every day, there's about how many people that receive Meals on Wheels? 500?
About 450 to 500
on
the day.
In a given day, 450 to 500 people.
Okay. All right, thank you. Next on the agenda, Marcy, we have some resolutions for us to consider.
Yep, yes, the Fair Board and the County Board of Commissioners honor Senior Volunteers of the Year, and that it happens during Senior Day at the County Fair. So the Advisory Council on Aging request nominations from the community and then look at those nominations. And this year, they've selected 2 people to honor as Seniors of the Year, Marge Pressler and Barbara Wilsinski. And Marge has volunteered as a co-facilitator with grief support groups for many years, as well as volunteering with an equestrian program for handicapped children. And then Barbara has volunteered as a leader of a grief share program, and she has organized entertainment for different nursing homes. So we're requesting that there be a resolution to honor each of these Seniors of the Year.
So I'm looking for a motion to move this to the full board to approve the 2 resolutions jointly together.
Move to approve.
We have a motion by Commissioner Placzek, support by Commissioner Mahoney. All in favor say aye.
Aye.
Opposed, the same. We will move these 2 resolutions to the full board. Thank you.
Thank you. And Senior Day at the fair is the same day as this committee meeting next month, so I won't be reporting.
We understand.
Next month, so, okay.
We do thank you for your, you are a very regular and faithful department head leader that reports to us. We thank you for all you do.
Okay, thank you.
And enjoy the fair. Next on the agenda, We have the Health Department monthly report. Hello, Richard.
Hello, good morning, good afternoon, Commissioners. Good to be here again. Pretty extensive report in your packet today, and I actually brought some information as well on a little flash drive that I could get part of it to work, but not all of it, but we'll go through that as I proceed through my report. Just a quick update on Ebola screening and monitoring, if you will. We did have one person in Jackson County who completed the active monitoring process without any problems whatsoever. People are very cooperative and understand the reason that we're doing the monitoring if they're coming back from one of the West African countries. The screening is continuing, though. There hasn't been a lot of discussion and visible national media coverage on Ebola recently. That's all good. Liberia has now been Ebola-free for more than 42 days, so they will probably be declared Ebola-free very soon, if they haven't already been by the World Health Organization. We're still working with, obviously, on a national basis and international basis with Sierra Leone and Guinea, so they're still struggling a bit. As you're probably aware, we do have 2 classes per year, if you will, of nursing students who come through the health department for their clinical-based practicum or internship that they need to complete for their bachelor's degrees. One of the groups of students that came through from University of Michigan, and I'm not going to remember what time frame this was, I think it was quite earlier this year or late last year, as one of their projects, they actually created a paper about children with special health care needs and what might need to be done to help support those children in the community from an emergency preparedness standpoint. So as I think was demonstrated in my report and with the document I'll pull up in a second here, we do try to focus on the emergency preparedness needs of all population groups through all programs that we support at the health department. So I'll just minimize this for a second and see if I can actually pull up what I'm talking about. Okay. Maybe you don't like what I'm doing. No, I can't get to the first page. Anyway, it is in your board packet, and what I provided is a copy of kind of a little pouch type of document that the nurses created. It's called ICE card, and ICE stands for in case of emergency. And on one side, it contains information about the child. The parent would decide whether or not to use this and when to use it if they wanted to. But it also includes little icons on the other side of the card that talk about food, water, whether they're okay or not okay, whether they're hurt or they need medications, that kind of thing. So it's a very easy thing for a child to point to in case they have a need. So I was very pleased to see that the nurses came up with that. It's a really interesting project, and we're kind of hoping that it'll be rolled out, if you will, across the state in some kind of a systematic manner. So it was nice to see them do that work. I can pull it up here. Thank you. There it is. So that's what it looks like. So it's a really nice card, and we were able to use some of our emergency preparedness funding as well to help support that. We've been very busy with health improvement related stuff as well on the health integration side. We've tried to engage with the city of Jackson a little bit more with the health improvement organization. I had a meeting in the month of July with Pat Birch at the city manager's level, and also Elizabeth Cross met with me with Pat, and our purpose was really to kind of describe and talk about what we're doing on a health improvement organization level with the coordinating council, and encourage the city, if they can find a way, to continue to participate with us in some way or another. We don't have representation, and we really would like to, so that was what that meeting was about. Work continues on the Family Stability Coordinating Council in the community. We're making progress. One more meeting will be held probably between now, and I'm saying the middle of August, and I think we'll have defined then what the purpose of this council is, and so the group that's come together can figure out how they want to structure it and move it forward with goals and objectives, and I'll keep you informed on how that's going. Lead screening, testing, and follow-up, we're making some good progress with that effort to integrate with Jackson Health Network. The quality measure has been introduced now to the Clinical Performance Committee of the Jackson Health Network. And when I talk about quality measures, what I mean is they're now going to be looking at developing a measure for lead screening within the clinically integrated network. And that's a very important first step. There'll be more development work that has to take place to define what that metric is for providers, but getting that step done was really significant. And we can also now upload the clinical notes and the discharge summaries that we do for lead poisoning investigations with our public health nurse in the community. So that capacity already exists. So there's a couple more pieces that we're still working on, and I'm sure we'll make progress as we move forward. The Community Health Assessment Report development is on page 3 of my report. And I guess I would elevate this to your knowledge, because what this represents now is kind of a more of a team-based approach to really writing up this report than what we've had in recent years. I have a lot of health education capacity at the health department that can help prevention and community health write up this report and make sure we're as comprehensive as possible about it. So that's going to happen. By the end of July, we will have all of the draft documentation and content pulled together, and then it will go to prevention and community health, and they'll pull it together with their marketing group. I listed a cancer control grant opportunity in my report on page 3 as well. And while we really wanted to pursue this, it wasn't a lot of money. It was only about $40,000. In the end, at the end of the day, what we ended up coming up with was the due date being by the end of this month, and everything else that we have on our plate, we just didn't have the resources to pursue it. We've had some conversation with county administration in the past, and I know you've probably talked about other kinds of positions that are needed in the county structure as well. But if there was one thing I would advocate for, it's finding a way to get some grant writing support or a grant writing position here in Jackson County. I know that there are a lot of opportunities on the health side, and maybe there are some in law enforcement and community action and anywhere else for that matter. These positions usually have a way of being able to be structured to pay for themselves through the successful grant applications. Another way we might approach that would be to look at cross-jurisdictional sharing. So in other words, this health department in Jackson is interested in sharing a position like that across multiple jurisdictions. So that might be some way to support it and look at it as well, and kind of a mutual shared of the cost of a position like that. Because the reality is sometimes I just don't have the staff time to be able to go after the grants, and it kind of is disappointing for us. Under personal and preventive health services, our outreach campaign on immunizations with the Rotary Club is going very well. I don't know if any of you have heard the purchase radio ads that have been WKHM and there are other 2 sister stations, but they have been running now since the end of June. If you haven't heard one, I encourage you to tune in and listen. They're wonderful. Dr. Van Schoik and Dr. Killian in the community participate in doing those radio ads with us. And I would pull them up and play them for you, but the audio portion on the computer down my feet isn't working today. I couldn't get it to play. And I don't know if Adam, if you can do anything, work your magic with that or not, but it is in board docs as well. But I'll keep moving in case he's successful. We were able to successfully fill an administrative clerk position in our immunization clinic. Jamie Golis is the person we selected for that, and so we're glad to have that full-time position filled again in the health department. Yeah, we can try it if you think it might work from there. Yeah, our phone came out of the bottom down there. Okay. Stick that in. Why don't you hold the, we're good. Okay. Don't see it happening. Okay, thank you. We wanted to share also with you a client testimonial that we received recently, and that's in my document here that I'll share with you. This was from a client that had been served by Ellen Lupo, a registered dietitian, a number of years ago. It's interesting sometimes when you run into people in the community and they remember having been taken care of in one way or another by the health department. But Ellen shared this with us, and you can see kind of what the testimonial says. It says, while working Kids Fest, I had a woman walk up to me and ask me if I was Ellen. I said yes, and she proceeded to tell me her name was Alice, and that I used to visit her when her daughter was a baby. She pointed to her daughter, who is now 10, and then thanked me for all the guidance and support I gave her while she was enrolled in MIHP. She was even able to recall the things we had talked about during our home visits. Today, Alice is a successful single mom with a beautiful 10-year-old daughter because she had the support and guidance of our MIP program. Research shows us the value of MIP in our clients' lives, but hearing it from a client is much more powerful. Thank you for sharing. It's an excellent example of the lasting effect and impact the work our home visitors make every day. So this really makes our day when we can receive something like this. Moving along, the National HIV Testing Week took place on a national basis, and we celebrated here and promoted as well in Jackson County from June 21st through the 27th. We did a lot of outreach messaging throughout the week on MLive, 211 Blast, public service announcements, and daily posts on our health department Facebook page. And it's interesting sometimes what staff will encounter sometimes when we do these kinds of events. And I'm just kind of paraphrasing from my report here that a couple of clients came into the clinic and they didn't really realize that we offered free HIV testing and screening at the health department. And we do that on a routine basis. But in conjunction with this national promotion event, people become more aware of it. So we're really pleased that we were able to take care of a couple people who obviously had some concerns and wanted to be tested. And this is just a copy of the press release that went out to the community concerning that. We're always kind of keeping track of and tracking and monitoring for potential health problems or threats in the community. MERS-CoV is one of those. That's the Middle East Respiratory Syndrome virus that continues to circulate in other parts of the world. This content I have in my report was really as a result of the Centers for Disease Control notifying us of a recent outbreak in the Republic of Korea. And so when that happens, they usually will send us an alert and encourage us and healthcare providers in the community to be prepared to detect and manage cases of MERS. And we have nothing happening here in the U.S., but just so you're aware, we do keep each other informed quite well about what the threats may be out there. We had our Clinical Laboratory Improvement Amendments Survey on June 18th, and we passed that survey, and every 2 years it takes place. And we're now, again, laboratory certified, so we're pleased to report that. One of the things that we've been doing for quite some time is really looking in depth at the STD clinic numbers for our clinic here in Jackson County at the Health Department. And in the context of looking at both in terms of volume of services we're providing and staffing, we also learned by looking at the data that over an 8-month time period from August of 2014 through March of 2015, we had been staffing for late clinic hours, and we had actually one patient visit during that whole time frame, and that was from 5 to 6 p.m. That's not cost-effective justification of our resources, so we have stopped doing that. So we just want you to know we're actively looking at these things and monitoring them appropriate. Now, the immunization clinic that we have will continue to remain open for late night hours once per month, and nursing staff will be trained to administer pregnancy tests as needed for WIC clients, because WIC is also open late one week per month, one night per month. And the reason for that is because those pregnancy tests are usually done through the STD clinic. So we don't lose continuity of service just because we have to make an internal change. I should have some results for you next month on the county employee flu shot survey. We're meeting next week, if you will, or maybe it's this week even, to look at the survey results and to do some further analysis of them using the software that we have at our fingertips. Car seat safety program is always busy. There's always an event going on. You can see what we did there on June 12th at Kids Fest. So we were present at the fairgrounds with everybody else in the community. It's always interesting to me the number of unsafe car seats that we find that basically need to be destroyed. And it's simply because they're obsolete, they've been recalled by the manufacturer, and people generally don't know it. But car seats also actually have a shelf life associated with them. They are plastic, and over time they tend to get brittle, particularly if they're left in vehicles in hot and cold temperatures. And so to some extent, they just are something that will wear out and they have to be replaced. So constantly kind of educating people about that is something that we do a lot of with our certified child passenger safety technicians. There's a couple updates on teen pregnancy. We're always busy with that, even during the summer, with the Get Real program and reaching out to teens. We were informed that we will be renewed for a lead outreach and education grant in 2016. That's $20,000. And one of the things that we want to do a little bit differently, a little bit more of with that grant beginning in October, is to also work with social worker and counselor associations, foster parent groups, pediatricians, and federally qualified health clinics to educate their staff to provide education resources and referrals to patients and families. The tobacco reduction program is going through some changes. It really has to do with a combination of things. Number one, the state innovation model is pushing forward very significantly in terms of really focusing on population health outcomes. And also a lot of health integration is built into the state innovation model for healthcare delivery in the future. So what's happening is we're beginning to see funding shifts from what they have historically been funding at the state level to things that are now oriented in a health integration way. So what's happening with the $30,000 that we normally receive per year from the tobacco control program is that they'll be asking us to do this on a more of a regional basis. We already do lead outreach and education on a regional basis, so this is no particular great surprise to us. Now, I indicated in my report that I thought was Prosperity Region 9. I'm not sure that's going to be the case. Within kind of our regional area here, only Jackson County and Ingham County were actually funded to work with the local health system and health system integration work. And that's simply because of the decrease in resources that's available, number one. And the other, I guess, positive thing I have to comment on is that the program specifically selected programs at the local level that they felt had maximized use of the resources and had had effective outcomes in the past and done a really good job. And we've done that in Jackson County. We've been doing it for quite some time in terms of really now, over the past 2 years since I've been here, integrating our efforts with the clinical healthcare system in the community. So that's a big plus for us. But looking at the goals for the next year, promoting the quit line to increase quit attempts and annual calls to the quit line, that's not really new, but it'll be done on a regional basis. Institutionalizing tobacco dependence treatment into clinical practices through education and training. So that's really very much in the same direction that we've been trying to go with the Jackson Health Network and Allegiance Health. It's just that whole integration effort. And then collaborating with community partners and health coalitions to promote sustainability of the programming to policymakers. And that actually is being described as interfacing with legislators potentially throughout a regional area to help educate them about the benefits of tobacco smoking cessation and what could be done from a policy perspective. More changes. The proposed hearing and vision program funding formula is changing. It actually, though, benefits us here in Jackson. Historically, there has not been a really, I guess what you'd call robust funding formula for hearing and vision screening program funding at the local level. Every health department is required to do this, and that's not changing as a result of this funding. But what's happening is that they've established 4 criteria for determining how the funding will take place. It's a combination of the number of children who need to be screened at a community level, the number of school districts, the number of school buildings, and then there's a travel factor kind of built in. Basically, if you have a widespread community with a lot of distance between different school districts, that there's a consideration for that. So in the aggregate, though, over the next convening 3 fiscal years, our total amount of funding for hearing and vision will increase by $29,000. So that's good for us. I guess in some ways not necessarily so good for other health departments because there's no real increase in funding for this across the state. It's simply kind of a redistribution of the funds where the need is greater and the formula suggests they should go. So there have been some loser health departments in this. But that's just the way the cookie crumbles, I suppose. Not a whole lot to report on for you with environmental health. Have been relatively quiet, but very busy. The campground, swimming pool, and temporary food inspections are, of course, ramp up this time of year, and Don and staff have been very busy meeting the demand, excuse me, along with well and septic field work. I have some animal shelter content, but I'm going to defer that to Don because he'll be right up after me. But there is a couple of other things I just wanted to bring to your attention that aren't in my report. Senate Bill 423 was recently introduced at the state level. I don't remember the sponsor. I think it might be Senator Stamos. And what this bill basically would attempt to do is to prevent future increases, if you will, in licensing fees for food service licenses at the community level. And part of it seems to be being driven by what the industry recognizes that the state of Michigan does through the Department of Agriculture for food facilities that they inspect. They inspect the grocery stores, the convenience stores, and so on. But the reality is there are a lot of differences in terms of, I mean, it's an apples to oranges comparison to compare what Michigan Department of Agriculture does as far as inspecting grocery stores and convenience stores compared to what we do. The frequency is different, how often we do it is different, and also the in-depth requirements that are associated with it are different. Plus, at the state level, the state significantly subsidizes the cost of providing those services to those types of facilities, so their inspection and licensing fees are considerably flatlined and kind of stable. Ours can change a little bit at the local level, and it really has to do with what the local policy is of the board relative to those fees. So I can tell you that our state association is opposed to this bill, and if it does come up and you have an opportunity to talk about it or look at it in more detail, I encourage you to do so, because it could potentially put a cap on what we could do from 2018 out. Now, we don't come to you frequently with license inspection or inspection fee requests, but this would prevent us potentially from doing so in the future, and I think that's not good for us here in Jackson County. So I wanted to bring that to your attention. There are two other bills which we don't have as much concern about. House Bill 4748 and 4749 really have been introduced from the perspective of legislators wanting to make sure that prison facility food service is inspected on some sort of regular routine basis. And we could do that at the local level through the health department. The contract food service provider, Aramark, would be the one required to pay the fees associated with that. So I just want to let you know that that continues to
And we were just discussing at lunch, the news just broke that Aramark no longer has the contract.
Oh,
so
okay.
There's
So maybe the bill will be rewritten.
Yes.
And
Thank you for that almost up-to-date information.
You're welcome. I think that constitutes my report for you.
Thank you, Richard. What comments or questions might you have? Thank you for that information.
Thank you.
Animal shelter?
Good afternoon, everybody.
Hello.
Hope you all had a nice weekend. Finally got some reasonable weather. Everything's relative, of course. Going over my second quarter report, regardless of what the subject line says. Okay, a formatting error, if you will. The first three bullet points, I've talked about in past reports. It's kind of been an ongoing project. And I just really want to highlight who's really responsible, the funding support, Friends of the Animals for the Jackson area, Dave Klein, as well as TAC Manufacturing. The fenced-in exercise area is being utilized. The cat condos are in place. Feel free to stop by, take a look at them. There are a couple little corner shelves to be added to a couple of those condos, but the cats are enjoying them. And we're hoping that the infection rates actually decrease a bit in the cat room due to stress levels. Now, we also, key thing is we are getting a new Knox box. I believe it's actually installed at this point in time, which will allow every police cruiser access to our building after hours. It's keyed exactly the same way to all the public schools. We just have to get a access card, a swipe card, if you will, for the front door. There'll be a front door key. The outlying police departments won't have to access the sheriff's department or the City of Jackson Police Department to get a key and swipe card like they've had to do in the past. So that's a key development, and we're looking forward to having that after-hours access for all police. The bullet point on the first page, concerning the Spring Arbor dog neglect case, we've been working a little closer with the prosecutor's office concerning some of these cases. I've been developing and keeping track of the costs that we incur as far as medical assessment of any animals that have been brought in. The Spring Arbor case is just the largest one to date, but I've actually been submitting some reimbursement cost data to the prosecutors for some of these cases in the hopes that maybe at some point down the line we actually may get reimbursed. I'm not holding my breath, mind you, if some of these individuals have no money, hence, I can't imagine getting reimbursement, but we are being considered at the court level, which is a good thing. Something that I do not have in my report, but most of you are probably well aware of. About a month and a half ago, our doctor, our veterinarian, did break her arm up in the shoulder area, bicycling accident, which took her out of the surgery situation. We had to do a little bit of scrambling. We did bring in Dr. Erin Whalen as a casual status situation. She is the veterinarian for Livingston County Animal Shelter as well as the Lenawee County Animal Shelter. She lives in Jackson County. So she has been coming in on a limited basis and doing some of our surgeries. We also got in contact with Cascades, and they are freeing up a few slots for us as well with their veterinarian. So that's helped quite a bit. And again, Friends of the Animals for the Jackson area kind of stepped up because we have this community cat project that I've brought to this commission before. We had to put that on a standstill with the bike accident. However, they have kind of made an arrangement with Cascades where Friends will foot the bill for some of these community cats to go over to Cascades for surgeries from our waiting list to try to whittle that down because the waiting list has just been getting a little bit bigger, and we haven't been able to fulfill that need. So that's, hands off to Cascades, Friends, for that particular situation. And then you have some of the just basic statistics for the second quarter, as well as year-over-year 6-month totals. One of the concerning things for us is the adoptions tend to be down, especially in the cat area. Not so much for the dogs. The dogs are pretty much even keel, but the cat adoptions are down. Our transfers are up. We're not exactly sure the reasoning behind this. The euthanasia rate is about the same. They're down. Our intake's down a little bit, and we're catching up here in the second quarter. Some possible reasons. Maybe we've reached the actual carrying capacity in the county for cat adoptions, whereby there isn't any excess capacity out there. We're really at the point where Cascades and us and private individuals are really just fulfilling that, rate of replacement, and we've caught up to everybody who wants a cat. Hard to say. We've had a little bit of turnover in our kennel attendance position, part-time position, so my, if you will, private marketing team that are actually interacting with the individuals coming in haven't been fully staffed all the time. That might be part of the reason. And I haven't run any cat sales yet because with our veterinarian down for the 10 count there, I didn't want to overload the system because I really had no surgery capacity to, increase the cat sales. So combination of all three of those reasons, hard to say, anecdotal only at this point. And then on a final note, the most recent Pets for Veterans campaign just ended on Saturday. Got started at the end of June and ended Saturday, as I said. To date, 9 dogs and 3 cats were adopted out, and we have 4 vouchers that are out with individuals who did not find the right pet, but they have about 30 days from this point in time to actually find that right pet. So again, another successful event. One of the things, that is a Friends of the Animals. They're the ones that are funding this. They're actively recruiting donations to refund that event right currently. They've got something on their website. And because the initial chunk of money that has been funding this has basically been depleted over the past two years or so. So get the word out. Friends need some more donations. Perhaps the second annual golf outing in September, if anybody's a golfer out there, will help fund that campaign again. Are there any questions?
Do you have a location? Which golf course will that be held at?
Ella Sharp, same place, about the same time.
What comments or questions might you have regarding animal shelter? Thank you for that information.
Thank you.
Next on the agenda, we have the claims from June. We have a motion and support to move to take care of the claims in June. All in favor say aye. Opposed, the same. Claims will be paid. Other meeting minutes. On board docs, you have the DHS board meeting minutes of May. You also have the August reporting schedule, including Department on Aging, possibly, maybe not, Health Department, Lifeways, and RSVP. That leads us now to public comment. Is there anyone that would like to address the board with public comment? Seeing none, are there any committee member or commissioner comments? Seeing none, we'll adjourn to the call of the chair.